generally here this spine alignment. So this is straight. Okay, generally, then this is normal. So if you see just lateral bending, then you should suspect that possibility of scoliosis. But if you see from the side, don't comment scoliosis. If you see from the side, what you can interpret is that lordosis, kyphosis, lordosis. But this is normal, right? If you want to say abnormal, you have to use the terminology is hyperkyphosis. Okay, so there is normal spica spine, lordosis, normal thoracic kyphosis, and normal lumbar spine lordosis. And if you look from here, and there is no lateral curvature. If you see this, there is some lateral curvature. We need to identify this is the structural scoliosis or post-stress scoliosis. Okay. Structural scoliosis is the scoliosis deformity because of air. Post-stress scoliosis is because of the posture. So what you have to do is, as the patient to sit down here, you look from behind. If there is a stay deformity, this is the structural problem here. If no more scoliosis, this is the problem is lower leg. So you continue to do lower leg your measurement, right? So in semester 7 we have the CSS lower leg measurement. If you ask the patient to sit, they sit here as a scoliosis deformity. Most likely this is the structural problem. To confirm this, ask the patient to bend forward, and then you see if the one side of ribs is going up, we call the wrist ham, right? So this is the confirmation of scoliosis. Okay. So why wrist ham is because your scoliosis is not only lateral curvature, it is rotational deformity. Okay. Kyphosis is one plane deformity. Okay. Kyphosis is one plane deformity. This is kyphosis. This is list one side, lateral bending. Scoliosis is anterior, posterior, lateral, and rotational deformity. Okay, so because of this, scoliosis is we call triplanar deformity. AP, lateral, rotation. So because of this rotation, if you ask the patient to bend forward, one side is going up. This is the confirmation of scoliosis. We do not need X-ray to diagnose the scoliosis. X-ray is for your cord angle severity calculation. Okay, so if you see the case of the spine, look from the back, look from the side, and comment on the curvature. Right? If you see some other abnormality like swelling, scar, then just continue. Okay. Then what you have to do is ask the patient to stand against the wall. Okay. Ask the patient to touch the occiput, scapula, bicep, and heel. Okay. This is called wall touch. S against the wall, and then all 4 points can touch. Spine is flexible. Sometimes like ankylosing spondylitis, then scoliosis, then other deformity. Patient's spine is not flexible. Patient cannot touch all this area. Okay, your heel, your bicep, your scapula, and your occiput all able to touch the wall. Then all touches negative. Patient's spine is flexible. Okay, this is look. Okay, then you feel. Use your thumb. Press along the spinous process. Okay, press along the spinous process. One on each side of the spinal process is the paravertebral muscle. Then you press along the paravertebral muscle. If the pain is over the spinal process, pathology is most likely bony origin. If the pain is the paravertebral muscle, pathology is most likely soft tissue origin. Okay, then you test for the deep tenderness. This is called deep tenderness, not the localized tenderness. Okay, so deep tenderness is inside the spinal canal, something like infection, tuberculosis, biogenesis infection. If you do like this, vibration inside the spinal canal, pain and blood pressure inside the spinal canal. This is superficial tenderness. Okay, this is a fracture deformity. This is for nerve root or muscle strain. So only one problem in the spine is after scoliosis is PID, right? So later we will continue as CP. If you press here, okay, if you press here, pain shooting down along the side of distribution down to the heel. This is called doorbell sign. Okay, doorbell sign. Doorbell sign is a U. Switch here, brain inside the house. So you switch on here, brain inside the house, like that. So you press here, going down. Okay, this is the doorbell sign. So this is what you have to demonstrate in the spine field. Okay, temperature, tenderness, and then doorbell sign. Then move. Okay, movement is the basis. You ask the patients to follow your movement and make sure you stand safe distance. Okay, during your UI4, I understand somewhat you can. Okay, patient is staying like this and you are in front of the patient, right? So sometimes some student as a patient shoulder movement first and then go inside like this. So it doesn't look nice as you are medical doctor, right? So keep the safe distance, okay, not to hit you, and then okay, so as the patient to bend forward, okay, bend backward, lateral bending, and rotation. Okay, so for rotation, we recommend you to go behind the pelvis and then hold the pelvis and ask the patient to rotate. Make sure this is not a hip movement. Okay, so hip joint is stabilized. Okay. So this is the rotation. Okay, flexion, extension, lateral bending, and rotation. Okay. So after that, measuring technique.
For the inspection, if the patient sits and the deformity resolves, then that's issue of the lower limb, right?
So this is called structural scoliosis. So the case is not the spine problem. So you have to demonstrate that lower limb is an issue. So this is, let's say, your iliac crest, and then this is the L5S1 junction. Okay, so you draw the line, you identify the iliac crest and then L5S1 junction. You make the one mark here. Okay, let's say his belt is one mark here. Okay, so then from here I take maybe 15 centimeter. Okay, I take just 15 centimeter. So my thumb is one mark. Okay, here one mark, here one mark, 15 centimeter. Okay, then you bend forward. So now from here to here, 19 centimeter. Okay. So this, okay. So this distance is spine excursion. Okay. Normally it should be 5 to 7 centimeter. Not should not be less than 4. Okay. Should not be less than. Actually, you are more than 5, but because we do not properly mark. Okay. So one mark here and one mark around 10 to 15 centimeter. Okay. So then as the patient to bend forward and then measure. Okay. So this is for the something like chest expansion, spine expansion. So flexibility of the spine. Okay. So look, we move, pressure. So this is in general what you have to do. Okay. So any question?